Everyone, hope you're doing well. I'm Dr. Samina Mitha. I'm a naturopathic doctor, and today I'm talking about different brands of inositol that have myo-inositol and D-inositol. And I just wanted to compare the brands and tell you a little bit about my experience with trying some of these supplements. So the first brand is probably one of the most popular brands out there. This is Ovasitol by Theralogics, and it comes in these small little packets, but you can also buy it in like a tub size form. I really like the travel packets. They're super easy to just stick into your purse or your bag and travel with. Basically, Ovasitol is great because it really just has myo-inositol and D-inositol. There's no added supplements in here. It mixes pretty well. From what I've used it, when I used it, I found that it mixed pretty well into water. Some people have some issues mixing myo-inositol. So what I usually suggest is even just putting a little bit of water into the cup, mixing it, and then putting more water so that you can get like a full glass of water when you drink it. You want to be drinking about 1 cup of water when you do have myo-inositol, because sometimes it can be stimulating to the digestive system. So you do want to make sure you drink enough water with it to dilute it. So this is Ovasitol by Theralogics. It has myo-inositol at 2,000 milligrams and D-inositol at 50 milligrams. This is that 40-to-1 ratio that we see in our ovaries. So this is why a lot of these supplements will have this ratio, because that's this naturally occurring amount in our ovaries. So very important to consider that, especially if there's cysts on the ovaries or multiple follicles. Using inositol supplement with myo-inositol and D-inositol can be really helpful. Okay, so that's the first one. The second one is PCOS Care. This is by BioClinic Naturals. And basically in this one, it has that myo-inositol at 2 grams, the D-inositol at 50 grams, just like Ovasitol. It also has 2 other supplements in here. We have a little bit of folate in its active form, methyl tetrahydrofolate, and also we have a little bit of B12. And the reason why a lot of these supplements will put B12 or folate inside is because a lot of patients will be on metformin. So we know that metformin can deplete B12. A little bit of folate deficiency we also see with metformin. So if you're using inositol alongside metformin, this can be helpful to mitigate some of those deficiencies. Also, folate is great for when you're trying to conceive, which a lot of women with PCOS are trying to regulate their cycles and they're trying to conceive. So using folate here, it can be helpful. PCOS Care, I find like this one isn't as sugary tasting. The powder is pretty fine. It mixes pretty well, just like Ovasitol, but just a little bit of a different supplement. This comes in a powdered form. It doesn't come in sachets. So these are the sachets. And so it might be, it is a smaller bottle. It only comes in 129 grams. So this won't last. Let me just do a calculation here and I can tell you exactly how long this would last for. So about 2.8 grams, 1.29. This would probably last you about 30 days. So a 30-day supply of PCOS Care. And I'm not sure the bottle of acetal, how big it is, but I do believe it does last a little bit longer. Okay, and then last but not least is Ovofolic. This is a Canadian brand by Elan Healthcare, a myo-inositol and D-inositol supplement. It also has that methyl tetrahydrofolate as well. This is in 200 micrograms. I believe it's similar. Yeah, in PCOS Care, there's also 200 micrograms methyl tetrahydrofolate, so that folic acid. It doesn't have B12 in it, just the folate. So if you're trying to conceive, this could be one that could be helpful because it has that folic acid, or folate, I should say, the active form of folate. I find this one mixes really well. It tastes pretty good. It doesn't have like any aftertaste or anything like that. The powder is pretty fine. You can, I don't know if you can see that, but it's pretty fine in there. I'll show you the other one too. PCOS Care. This one's a little bit, oh, I don't know if you can see that properly. Let me just do that. There you go. It's a little bit darker, mostly because it has these additional supplements. It also has a little bit of rice hull powder inside of here, so a little bit of a filler there. So that's where you're seeing that color, I believe. This one, I believe ovasitol, or sorry, ovafolic doesn't have any preservatives. I'm just trying to see here and make sure. I believe there's no non-medicinal ingredients in this one, so it's pretty pure. Even with ovasitol, I think that's the same. So yeah, this one does have a little bit of that filler in there. And I'm just gonna also just double check ovasitol so I can tell you for sure. But basically, I find that ovasitol and ovafolic mix pretty well. And just checking one thing here. Yeah, there's no other ingredients here. So I like that fact in ovasitol and ovafolic. We don't have any other fillers in there. Ovasitol doesn't have that folate, and this one does. So if you have a supplement that already has folate in it, like a prenatal, you know, maybe considering just the ovasitol instead. So I hope that was helpful to give you an idea of the different brands of myoinositol and D-chiroinositol. Today, I have ovafolic in here. I find that putting it in a really tall water bottle and drinking it throughout the day has been really helpful for me to manage and stabilize blood sugar throughout the day. But you can always just put it in a glass of water and drink it in the morning and then drink it in the evening. If you notoriously forget that second dose, you can put 2 doses together. But I do find that when you spread it out, it does kind of help stabilize that blood sugar throughout the whole day. So again, hope this was helpful. If you have any comments or questions, please drop them below, and I'll see you in the next video.